Welcome again to Microbiotics Bio Talk. How are you? Hope you're fine. Of course, I'm fine, and I hope you're fine too. So, today we'll be continuing from where we stopped our last Bio Talk on malnutrition. We'll be discussing the should I call it the symptoms, the diagnosis, the treatments, and stuff like that. So it's just a continuation of where we ended the talk the last time. So let's start from the symptoms, the physical manifestation of malnutrition, especially undernutrition. Don't forget that we've said that malnutrition is either in form of being overweight or being underweight. So the clinical presentation of severe malnutrition varies. It varies greatly on the should I call it on the severity on how long the person has been on calorie restriction. So and in children is different, in adults is different, but there is always this general appearance of dehydration and of being shrunken and wasted due to reduced level of fat. Don't forget that it's the accumulation of fat on our body that makes us appear fresh. So if there are reduced fats on the body, the person will appear shrunken, and it will give an appearance of an old man, like an old person, no shrunken face of somebody who is old. And of course, Marasmus also is associated with hypotension, that's low blood pressure, then hypothermia, that's low body temperature, and issues with the heart, the irregular beating of the heart. So, and of course, the body weight will be very different and from other body weight of normal children. Of course, most studies have revealed that a child who is malnourished will be less than 60% of the weight for age. There is a particular weight that is associated with age. So, and if that child is not actually up to that particular body weight, then it's possible that the person is malnourished. And don't forget as well that growth stunting. There's possibility of growth stunting. So if there's growth stunting, then when you're not eating, of course, it's believed that the growth of the individual will be kind of stunted. So it's just one of the things to expect. So, and we've already mentioned that there will be an impairment in the cardiovascular function, of course. So let's quickly go to how it is being diagnosed. In most countries, laboratory investigation can be used to check the protein energy level, along with checking the level of micronutrients in the body, the deficiency, whether the person is deficient in those required minerals that the body needs. When I'm saying minerals, I'm not talking about cocoa. I'm talking about micronutrients that the body needs. I'm not talking about coke or malt or whatever it is that we drink in our spare time. So, and we can also check the blood glucose level, can check the electrolyte level, we can do stool microscopy, we look at a lot of things, even urine, we check for some particular parameters to actually have an idea whether the person is malnourished or not. And well, it's once you look at your child, and you realize that it's not having the pictured weight of the person, that the pictured body weight of people, of other children that is his or her age, then you know that the person is very malnourished. And I don't think anybody who is malnourished will not know anyway. If a child is malnourished, the parents will know, because you know that you're not feeding the child well, or the child is not eating well, even if it's not you that is not feeding the child. So the physical appearance is what most of us are well aware of. So in terms of treatment, before we go to treatment, let's first look at how being malnourished can cause death, and we'll know how to plan against how to treat and manage it. Now, when somebody is malnourished or severely malnourished, death can occur through a lot of ways, and one of the ways is through infection. We've already said it earlier that if a child is malnourished, is susceptible to infection, is likely to actually contract infection faster than those who are eating well. So, and another causes of deaths due to malnutrition is dehydration, the loss of body electrolytes. The more and body water, the more you are severely malnourished, the more you get dehydrated, and that can lead to death. Then electrolyte imbalance can also cause it. The electrolytes that are supposed to actually be transmitting signals from along the nervous system, the imbalance, and even the one that keeps the guts, the stomach, the blood, keeps them balanced. Once those electrolytes are lost, then there will be issues. Then definitely heart failure. I said it the other time that is associated with cardiovascular issues. So the treatment of Marasmus can be in an hospital or can be community based, and studies have shown that community based is actually better instead of putting the child in an hospital. In the community, there's actually a lot of as long as it's not, the malnutrition has not led to other severe complications anyway. So, and the following steps are used in treating malnutrition and in managing it. The first one is resuscitation and stabilization. Now, because of the loss of electrolytes and due to infection, the main aim of resuscitation and stabilization is to first rehydrate the body, and then to prevent infection to progress further. And this will reduce the complication, and then you can now move to the next phase. So the next phase is actually nutritional rehabilitation. Before I go to the next phase, okay, let me go to the next phase, which is actually nutrition rehabilitation. In nutrition rehabilitation, you've already rehydrated the child, you've already started treating you've treated the infections that he or she may be susceptible to. So the next thing is to start working on the child appetite, so that you start start increasing the calorie intake, start allowing the child to feed. Then, of course, you move to vaccination to prevent other diseases. And then the child needs to be fed more than, of course, his or her peers, so that he'll be able to catch up with the weight. And this can take like 2 to 6 weeks. So, and during this phase, it's important to encourage the mother and the child to interact better, so that the development will not be delayed. And then the last phase of management is follow-up and prevention of recurrence. Of course, there is risk of relapse. If the child is not eating well after all these the first two phases, then the child will definitely relapse. It's going to go back into malnutrition. So it is important to follow up on the patient to prevent marasmus from occurring again. Further education should be provided for the mother, and then most of the time governments take care of kids that are extremely malnourished by providing them with good meals, water, good adequate drinking water, adequate food supplies, and the control of infectious disease. So we are going to stop here again today. Let's stop here today. We'll also further talk about the other part of the talk. We'll be presenting the other part of the talk another day. So please, and as usual, we're going to attach some information with our talk so that you'll be able to extract some information there. And it's very important that if you suspect that a child is malnourished around you, please, you can definitely report to the health center around you. It's very important. It's one of the diseases or one of the health conditions that we are always on the lookout for. So please don't keep it inside. Like I said, all these diseases that we'll be discussing henceforth are diseases of international priority. They are reportable diseases. So if you see a malnourished child, malnourished mother, or even malnourished adults, please let's say about it. So till next time that we'll be talking, take care of yourself and have a lovely day ahead.
Just enough space, just enough attention. An art form that keeps her on my line. Pure vibes and inshallah. When it comes to you and I,
baby, see the tears not forever. We go on a danger, baby, for the waste I surrender. Baby, see the waste on my hand.